in there. This is a very intriguing case titled Chronic Foot Pain, Cuboid Syndrome, ? Go ahead and flip the page. The title page is Jerry Hesch from the Hesch Institute, and our website is www.hes like Sam, CH, institute.com. We do consultation, treatment, seminars, and distance learning. And we operate out of Henderson, Nevada, close to Las Vegas. So we're looking at Kyle, his right foot, and he's been on about a 5-year odyssey with it.
Correct.
He had an impact injury to the lateral border of his foot, and for the last 5 years has not been able to get pain relief.
Correct.
Can you give us just a couple of sentences summarizing the status of the injury and what it's been, what it has meant for you out of pocket?
Right. Initial impact, playing basketball, felt something go off, consulted close to 100 doctors and have still not gotten the relief, and spent close to 6 figures on this foot. It's severely impacted my quality of life, and hopefully Jerry can help me out.
So when you speak of 6 figures, you're talking about over the last 5 years out of pocket.
Correct.
So if we were to look at insurance dollars?
With insurance, close to probably $250,000.
Okay, and so what surgeries have you had for that?
Well, I've had 2 fractures due to lacrosse in college. First fracture was 2006, a Jones fracture. They put a screw in there.
They put a screw in the 5th metatarsal.
Correct. And the screw bothered me a lot, so I elected to have it removed 6 months later. And I was able to get back to 100%, I felt like, of activities after about a year. And probably about a year and a half, 2 years after the screw was removed is when I had the next injury playing basketball. And that's kind of been the catalyst of what set this whole 5-year journey in motion.
And the surgery you've had since then?
Was in 2009. Yes, I elected for exploratory surgery, then went in and did a debridement of the 5th metatarsal and removed the bursa of the...
And that was at a renowned sports clinic, right? Don't say the name.
Correct.
Okay. So the one procedure that made profound difference but just didn't last was a cuboid whip manipulation.
Correct. It wasn't a whip, it was the thumb on the bottom of the foot. After you constitute,
that's what they call it.
Okay.
That's what they call it.
Because I know there's the snake whip, and
well,
that stuff has injured me more sometimes. But
so, yeah, so they've tried a few different cuboid MOB techniques.
Correct.
All right. So right now you have a severe functional limit.
Correct. Yes.
And
in my right foot, it's very hard to weight bear. I compensate heavily on my left side, which also in turn has its consequences. And my just quality of life has decreased extremely. I was very active. I was always an athlete growing up, and now I am not.
Can we go look at you weight bear on the right foot, please? First,
Sure.
show us on the left briefly. Okay.
Balance most of my weight on my left.
Good.
foot.
So you can stand on the left. Okay.
My right, I can't throw my weight up on it. If I were to hold the table, I could for a little bit, but I can't bear weight on the exterior of my foot. That 5th metatarsal area is
Okay.
very painful.
So just show us one more time.
This is the left.
Hold on. I got to adjust the focus here. My staff left me about 2 hours ago. Go ahead.
This is the left foot,
Uh-huh.
and that's the right.
You just can't do it.
I can't do it.
Can you do it if you hang on for balance?
Yeah.
Okay. Alrighty. So why don't you lie on your back, please? But this time I want your feet down at this end of the bed. It'll be a lot easier to film. I'll take that. So I want you on your back, please, looking up. So I did screen the rest of your body, and because I am camera person and clinician, I will try and keep out of your way, out of the way of the film. Can you show me your strength on the unaffected side? Pull the foot up and out. Okay, good. Show me how strong you are. Good. Pull it up and in, please. Show me how strong you are. Okay, pull this one up and in, hard as you can. Hold it there. Okay, is that the best you can do?
That's the best I can do. It hurts if I try to restrict.
It hurts.
Yes.
Okay, so hold it up and out, please. Okay, show me how strong you are. Very weak.
Very weak.
Okay, this foot, his main complaint is in the region of the cuboid and the fifth metatarsal head. Okay, both of which feel prominent, and the soft tissue around them feels somewhat thick on the right side, but definitely there's more bony prominence there. I can grab the base of the fifth metatarsal, and I can really stabilize the foot. I can test small movements in that structure, and I can capture the cuboid, and I can feel a little bit of yield, which it's supposed to do. It's supposed to have a little bit of yield. I can capture the midfoot, and you can see that he has good midfoot mobility. I can capture the calcaneus, and of course some movement translates superiorly through the leg. And I haven't blocked the ankle joint. I can block the ankle joint now, and that greatly reduces the movement, much more isolates the subtalar joint. When I grab this foot, the metatarsal, I can't create any motion that I can perceive. When I capture the cuboid, I can't create any discernible motion. Okay? When I capture the midfoot and I'm trying to get it to pronate, I cannot produce any movement. When I capture the calcaneus, there is just the slightest medial lateral motion. If I try to push him into valgus, very little. If I try to push him into varus, very little motion. And if I block out the ankle joint, then there's really no movement whatsoever in that articulation. I'm going to look at your incredibly, your dorsiflexion is equal on both sides. Let me have you lie, one more point. When I take up the slack through the table and I spring his malleolus, you can see a little bit of give, a tiny little bit of bouncing. On this side, when I take up the slack through his structure and through the table, I feel like I'm pushing against a block of granite. Can I have you lie on your stomach with your feet overhanging, please? So if I block the lower extremity, a little bit of that movement translates up and through it, but not much. Okay, so he's got free and easy calcaneal inversion and eversion. Honest, this is it. That is absolute, all that he has. You can see a little bit of difference. You can see a little bit of movement there. And if I try transverse plane rotation, it is so minimal. You can see it, or I can see it. It's less than 5 degrees. Now if I capture the back of the malleolus and I try and spring it, there's no yield. If I isolate the head of the fibula, on the right it is posterior, it's prominent, and I can spring and create motion through that structure that travels through the leg and through the thigh. On this side, there is no motion available, so I can't take up the slack, I can't spring it, I can't induce any motion unless I use a very large amount of force, okay? Or do it wrong. If I load the leg improperly, yes, I can spring the hip joint, but we're actually trying to isolate this very specific joint. So I have a slight medial force and an anterior force, and there's no give. Now you are tight in all of your hip rotators on that side. I'm trying to spring that trochanter, probably not visualized on the camera, but this one I can spring and we get movement through the hip. On the right side there really is no movement. So he seems to fit what I have described as a type 2 cuboid syndrome, in which it is a whole pattern involving the major articulations throughout the foot and ankle. And so what I want to do is start mobilizing all of the major joints in the foot and ankle on the right, and also treat the hip, and then come back and film. So it's almost 4:30 now. I'll treat him for about 15 minutes, and we will come back and film the results. And lastly, on this film, his mother is with us. Do you want to just give a real quick commentary?
Other than the fact that from a mother, it breaks your heart to see your child struggle.
It's probably gone on much more than you could ever imagine.
Without a doubt.
So let's see what we can do. I'll stop filming and thank you.